Everybody, my name is Taylor Belwomany, and I'm one of the clinical supervisors at our Entry to School program. Thanks so much for joining in for another Entry to School webinar. Today, our topic is transition to school. So our agenda for today, we're going to talk about the second half of the Entry to School program, what to expect in kindergarten, and how to prepare your child for school, your school team, and how Erin Oak Kids plays a role, collaboration, effective communication, and advocacy, and next steps. So the entry to school transition supports. So as your child is currently in the 6-month in-center component of the entry to school program, they will soon be going to school. So your child is provided with transition supports for up to 6 months from Erin Oak Kids. So families and educators can access consultative services from our staff at Erin Oak Kids as needed during your child's first 6 months in school. Support may include case conferences, transition meetings with yourself and the school team, observations, so coming into the classroom and being able to observe your child, and consultation to school staff. So this really looks like providing suggestions, strategies, or support around areas that we saw in the entry to school program and specific strategies that maybe worked really well for us in our classrooms. So this does not mean that you will have a clinician or a clinical supervisor every day in your child's classroom. However, as needed, you will have support, be able to go in and facilitate and join in this capacity. So this includes children attending the Peel District School Board or the Dufferin Peel Catholic District School Board. Both of these school boards are able to have the Erin Oak Kids, clinicians, and clinical supervisors participate. The transition teams for your child will include school personnel, Erin Oak Kids staff, and yourselves, parents or caregivers. So the Erin Oak Kids staff that would be able to participate in this collaboration piece is your clinical supervisor and the behavior clinicians who directly supported your child in the classroom. So what to expect when your child enters kindergarten or grade 1? So it is a new environment and it's going to require some generalization of skills. So as we do have group learning in our entry to school classrooms, they are smaller scaled and have more support. So your child will likely be entering larger classrooms of 25 plus kiddos. So a lot more kiddos there. However, they've already started to build those foundational skills in the entry to school program. And the next step is to generalize it so that they're able to carry those skill sets over into their new classroom environments. So we really want to remember that school is a new environment for your child. There's new adults, there's new settings, new expectations, peers, and it might take some time for your child to generalize these skills, to regulate, to adapt, and that's okay. We really want to make sure that we're giving your child some time to process and adjust. So structure can vary from school to school and teacher to teacher, but generally what you can expect in kindergarten is outdoor time, which is more of that unstructured play time, carpet time, which is those group setting periods, group learning, songs, calendar, snack or lunch time. Snack is free flowing, with lunch, the students are all eating together. There's quiet reading or quiet learning moments, daily transitions to various areas within the classroom in the school. So going to the library, going to gym, going to the craft center, the play areas. And then there's different centers or stations of different activities. So because kindergarten is very play-based and motivation-based, there's lots of different areas, centers, and stations for your child to explore. And again, this is really free-flowing. There's some choice-making elements in it. And then there's some opportunities for the teacher to work in smaller groups with the children. This may differ a little bit from grade 1, where there might be some more structured and learning opportunities. So preparing your child for school. Many of these skills that you see your child has been working on in the entry to school program, but it's really important to continue working with your child at home, practicing some of these skills at home. We really want to facilitate as much independence as possible, but that's going to look different based on every child and meeting your child where they're at. How can we provide them opportunities to increase their independence? And what does independence look like for them in certain activities or routines? We really want to have your child involved in those daily routines, those caregiver routines, those playing with props, playing with toys, playing with people, chores in the home. So we really want to ensure that we're providing them with as much learning opportunities at home as possible. We really want to maybe look at referencing our webinar talking about learning in the natural environment and everyday activities, just for a frame of reference on how to integrate your child into more learning opportunities in the home. So thinking about carrying your backpack, so having your child carry the backpack to entry to school, or if you're going on a bus or to grandma's house for an overnight, can they help carry that backpack? Can they help put things in their backpack, take it out, such as their snack bag, their water bottle? And also practicing opening and closing containers for snack and lunch. So if you already have those lunch bags and snack containers that they're going to bring to their classrooms in school, that would be helpful to practice setting that up in the home. So if you are having snack time at home, maybe think about putting it in some of those containers so that they can practice opening, closing, or asking for help. We really want to focus on increasing independence in dressing and in the washroom routine. Because there are more children in the classroom, as I mentioned, we really want to have your child be as independent as possible. So practice putting on socks and shoes in home, putting on jackets and hats for those colder months, taking them off as well and putting them away. And thinking about establishing some hand washing routines. How can we keep their hands busy with hand washing? Can we have them turning on and off the water, rubbing their hands, rubbing their soap, drying their hands? And same with their toileting routines. And this may look different if your child is still in a diaper, but that's okay. Just speak to your school staff about what that's going to look like for your child. And can they still have some independence in those routines? Pulling up and down their pants, their underwear. So really just thinking about what that independence level looks like for your child. And then thinking about tidying up. So can we increase their ability of tolerating and participating in cleanup routines and even recognizing their first name? So we naturally do this by having their names on their cubbies, on their art activities. So thinking about, can that be something that you're starting to practice at home in fun and natural ways? So meeting the school teams. School teams at both of the school boards can include behavioral analysis, ABA facilitators, itinerants, speech language pathologists, occupational therapists, social workers. So there's really big school teams, really just depending on your needs. I encourage you to talk to your school specifically about how to access interprofessional teams. However, your main contact can often be your classroom teacher, your teaching assistant, or your educational resource worker or educational assistant, the special education resource teacher, which is also called a CERT, or your admin. So that could look like your principal or vice principal. So like at Aeronaut Kids, there's a lot of acronyms to learn. So don't be overwhelmed and feel free to ask questions whenever is needed. So what is the role of Aeronaut Kids as you journey through these next transitions and steps for your child? So we are there as part of that collaboration process to work closely with your child's school team and you as parents, caregivers. So our behavior clinicians and clinical supervisors are there as needed to be able to consult, to observe, to provide strategies and resources. Also, it's our goal to really empower parents and caregivers to be active participants in the child's transition to school. We're going to talk about this in a few slides, but I really can't emphasize enough that parents and caregivers as active participants is really going to be one of those main takeaways and really help in the success of that collaboration piece. Erano kids can support in case conferences and sharing of information. So relaying information to yourselves and to their teachers, their educational assistants, their school teams about what we saw directly in the entry to school program, some of the goals that we worked on, some of the programming, and some of the needs, barriers, or strategies. We can provide further information on what motivates your child, transition strategies, visual strategies, and reinforcement strategies. And again, as mentioned, we can share strengths and needs in the domains identified in the program. So that specifically could look like the communication domain, play, social interaction, functional routines, emotional regulation, and behavior management. Supporting documents. So throughout your journey at Airnote Kids Entry to School program, you've likely received a few documents. So you might be thinking, what do I do with these? What can they be useful for? So the first document you received was the behavior plan. That is what outlined the goals that we've been focusing on for the previous 6 months, based off of the assessments, parent feedback, and parent goals. So that was a nice documentation to perhaps provide your school when you first registered so that they knew a little bit about your child. However, the service summary, which is completed at the end of the 6 months, is really going to highlight the strengths for your child, some of their motivators, strategies to support their learning, plans for generalization across environments, and recommendations. So this service summary is where we recompleted the first assessment that we did. We were able to identify some gaps, fill those in, and to really determine the most up-to-date skill set and needs for your child. And this is going to be important because you can provide this to your school and to your teachers as guidelines to where some of your child's needs and strengths are currently. So this will be provided to you in paper copy. However, this also will be on the Airnote Kids Connect portal. So you can feel free to print this off and give it to your school team. So let's look a little bit about what does collaboration even mean? So this key to successful transition to school is going to be that collaboration piece. And a successful collaboration will foster those stronger connections between the home and the school environment. So we really want to establish that through open two-way communication regarding your child's transition process. The next few slides that we're going to discuss together are really going to talk about some strategies to build on effective collaboration and help prepare you for what might be needed for your child's transition. But overall, that collaboration can look like participating in school team meetings. It can look like having the opportunity to share successful strategies, and it can really help foster and create collaborative discussions. So effective communication, what does that look like? How do we have it? So what we really want to focus on here is having higher quality solutions to problems. We really want to be able to have effective collaboration between teachers and school teams because that's really been linked to gains in student achievement, higher quality solutions, as mentioned, and increased self-efficacy among all staff and among caregivers. So when there's more ideas, when we're able to communicate effectively, we're able to problem solve more effectively. And when we're looking at that increased self-efficacy among all staff, we want your child to feel like they are getting the most support possible. And that typically happens when the staff feel confident in their ability to support your child. We want your child to be able to reach their goals because they have a whole team of confident staff behind them. So effective communication ensures discussions that are centered around the needs of the child. And this really includes the following. So a cooperative approach. So we really want to have that mindset of we're developing problem solving and solutions together. The more ideas that we have, the better that we are able to come up with a practical and functional solution. So if your child is having difficulty transitioning, we work together on identifying the best strategy, whether that's using a transition item, building a more positive connection, thinking about singing songs. We're having that cooperative approach. Focus on sustainability. So this is essentially really focusing on those positive educational outcomes. We want skills to be sustainable, to maintain, to have lasting effects for better outcomes. We want to make sure that we're asking school staff something that's possible for them to do in that school environment. So really thinking about what is practical and appropriate to implement in the school environment that will help the outcome for your child and for the school. And then we really want to think about prioritizing and using facts. So we really want to make sure we are sharing factual information, and that's really going to assist us in fostering decisions together. We want to talk about things that we know to be true. We know strategies that have worked successfully in the past, and that's really going to help us to identify where we go next from here. Always remember, you know your child best. So we really encourage you as parents and caregivers to be open, to be honest. We all want the same thing, what is best for your child. The more that we know as school teams, as Erin Oak Kids teams, the more we can prepare and support. So sometimes we know it can be really difficult to talk about those challenging moments or things that you're struggling with. But remember, being open and honest can help us to all foster that collaboration piece together to come up with more solutions and ideas. So we really encourage you to be prepared to talk about your child's likes and dislikes. Maybe have a written list or even on your phone, a running list of the things that they like to do or don't like to do. The routines that they engage in within the home. Talk about, oh yeah, we really get them involved in bath time or dressing, or being honest about toileting is really not going well for us right now. This is how we practice it. Talking about the way your child communicates. So your child has multiple ways they're probably communicating through looking at you, noticing words, sounds, gestures. So thinking about how they request, what does that look like? What does protesting look like? Are they shaking their head? Are they crying? Are they pushing things away? The more information that you have about your child's communication can, again, help us to be able to increase some of those strategies in the classroom to facilitate communication. Daily living skills that your child either has or is working on. So again, coming back into those routines in the home within toileting and feeding. What does that look like currently? What are they able to do? What do you have to help them with? And then again, just being really open about those challenging or interfering behaviors. If your child's a flight risk, maybe there's some aggressive behaviors that you've noticed, scratching or hitting or pushing away, throwing items, or self-stimulatory behavior. So maybe it's just getting out some of that energy by jumping or spinning or making some sounds. Really letting your teaching team know, again, is only going to help them to be more prepared so that if something does happen, we can be proactive about it, not just reactive. And really trying to identify, are there triggers that you're noticing every time you say no, put toys away, deny something? Or are there strategies? So maybe it's giving a hug, offering choices, modeling language. And if you're not sure, then I encourage you to look back to our webinar on challenging or interfering behavior that might help you to hone in a little bit of this information. Identify your child's strengths and areas of need. And if you're not sure, then please refer to your clinical supervisor or those documentations that you've been provided, because those assessments and observations in the classroom based off of your Erin Oak team will help to be supportive to identify those pieces. And then really just thinking to yourself, what are your goals for your child? Is it to, just be safe and happy in the classroom? Is it to learn new skills, to increase some more independence, to make some friends? What are your goals for your child? And on that note, if you're really not sure where to begin, let's look at it together. So what are some goals to consider? Remember, if your child is just starting kindergarten, it is a 2-year curriculum. So really, these goals are to think about what is realistic to, accomplish at that end of the 2 years. And I also want to highlight again that independence looks different for every child's skill set. We really want to continue to provide those opportunities at home and in school to practice those skills and to lead to more of that independence. Independence for your child could look like just needing less support in an area. So maybe in washing hands, as opposed to physically guiding them, you're able to just tap their elbows or point or demonstrate. And that could look like a further step of independence. So now let's consider some of these goals. Following daily routines. Maybe that's following simple instructions in the routines. Go get your lunch bag, your snack, clean up. And those are things you can continue to practice at home. Again, that developing independence piece, as mentioned, can look really different for some kiddos. Maybe it's just requiring less assistance. Maybe it's being able to complete tasks alone. Sharing items. So for some of our children who maybe don't have cousins, siblings around them, this might be one of their first experiences going into a classroom of peers. So really thinking about being able to tear and take with peers, to share, to tolerate them in their spaces. Playing with peers. So maybe one of the first goals is just playing side by side with peers, to share items with peers, to play with the same items as peers, to watch them and play. And it could be up into pretend playing with peers, participating in a kitchen routine where they're making food together. Problem solving skills. So being able to identify, I'm missing something, I need to ask for help, or I'm having difficulty facilitating something, this craft isn't working, what can I do, how can I make it work, or the puzzle piece isn't fitting, I have to turn it around. So having more of those moments of sticking in longer to problem solve as opposed to just walking away. And communication. And that communication piece, again, is going to look different for every child. Is that using gestures, sounds, words? Is it hand leading? And this communication piece, we want to generalize across different environments. Being able to communicate for help at school if they can't open their snack, or being able to request if they're missing something. Oh, I don't know where my hat went. Or to protest. I really don't want to do that right now. Or I don't want to paint, but I'll color instead. So really thinking about how can we develop some of these goals for our children, and thinking about that 1 year of the first year of kindergarten, what you'd like to ultimately have a goal. And then at the end of the 2 years, as it is that 2-year curriculum. Okay, so advocacy. This is what we're going to look at in the next couple of slides. And really what we want to emphasize is it's not what you say, but it's how you say it. It's going to be that quality of the interaction that you have with the school team. So how can we be advocates for our children? Remember first, it's really important to be prepared to present the facts and documentation. Sharing the service summary, sharing any sort of notes or other documents that you might think is helpful for the school team. It's also important that you are really actively listening, asking questions, being confident, ask for assistance if necessary too. If you don't know something, please don't be afraid to ask, especially if it's your first time with a child entering school. Remember that you have the firsthand knowledge. You know your child the best. So being sure that you're providing all of the important information. You have extensive familiarity with your child in a variety of settings and situations. So share this. You know how your child is going into new environments, seeing new people, where they are their most comfortable moments. Help plan the program for your child. Let the school team know where they can be more independent and where they might need more help. What will certain things look like for your child? Participate in discussions and meetings. So take notes, actively listen. Really feel free to chime in, provide strategies. Again, you are going to be that person that is part of your child's school journey for the next 18 years. So really starting to get into the groove of participating in these discussions now is only going to continue to help support your child as you move through the school system together. Really take time to digest information. If it's something new, something you're struggling with, it's okay to sit and process and digest the information before making decisions. And again, really just ensuring that you're sharing your thoughts and your goals for your child, because at the end of the day, that is really what's going to be important, that you can establish goals that your child can be successful at. Okay. And with that, I'm going to stop sharing my screen here. But the next steps that really do happen in our entry to school program is at the end of your first cohort, please ensure that you are notifying your school as you register that your child is part of the entry to school program. In the Peel School Board, an ABA facilitator will likely already have been in contact with your clinical supervisor and may have already been in contact with you to ask some questions about your child. That ABA facilitator really is that bridge between Arano Kids and the Peel School Board. So they're the ones who are going to be able to facilitate meetings, observations, and discussions about your child's transition into school. We as clinicians at Arano Kids will always book the appointments in your child's profile, write clinical documentation, or give you phone calls to discuss if we did attend any meetings or observations without you. If you are part of the Catholic School Board, please again let your school know that your child is part of the entry to school program. From there, the school team or yourselves can invite Arano Kids to participate in any school meetings. Arano Kids cannot initiate that process, but if schools reach out to us or the parents invite us to school collaborative meetings, we will do our best to be there and to be active participants in that meeting. And from there, once that process is started for us, we are able to reach back out to the schools to plan for observations or consultations as needed. So again, really make sure that you are connecting with your school team to initiate these transition supports. Let them know that you want your clinicians at Arano Kids to support this process. If you have any further questions, please don't hesitate to reach out to your clinical supervisor who will be able to support you throughout your transition to school. Again, it's been really lovely having you participate in this transition to school webinar. I know it's a big and sometimes nerve-wracking process of the program, but we're really excited for your child's transition into kindergarten or grade 1 and to really see their success as they move on to their next learning environment. So thank you.